Well, Dr. Abs, you have absolutely lit up the questions. So people want to see you, obviously, and I want to hear from you. So we're going to shut up now, and we'll rifle some questions at you.
I'll echo
what we had
in terms of acrylamide, just for kind of 30 seconds.
Carry on. Yeah.
So I think it also has reproductive harm to people. Some animal studies have shown that high doses of it can have negative effects on reproduction and development. We do need more research on it, but from what we can see so far, it's entirely detrimental to that as well, and even genotoxicity. So certain findings have shown that acrylamide can cause mutations and damage to DNA. Now, the lab studies, they're not in vivo for obvious reasons, but there's enough there to suggest that it's more than just a neurotoxin, and it's horrendous. Interestingly, I've never had coffee in my life or tea.
Well done.
Cool. Fantastic. Right. Okay.
Yes.
Now, let's have a look at this.
Avoid the acrylamide.
My gum disease has disappeared since going keto or carnivore and switching to a hydroxyapatite toothpaste, which is just a mineral toothpaste.
Yeah.
I use salt, by the way. So a salt toothpaste. That was just a statement, but here we go. What is the best way to prevent plaque teeth stains in addition to eating a carnivore keto diet?
Sure. So it's really not that complicated, and it's like a lot of things in the carnivore community, not that expensive either. It is literally just making sure it's an electric toothbrush and you've got a good technique. That is it. That is literally all it is. And to clean in between with something, either a water flosser or traditional floss. Water floss just fires big bursts of water for the bottom. You can get it probably for like 15, 20 pounds on Amazon. You can do the whole mouth in 30 seconds, something like that. But I do want to stress, I'm not actively practicing dentistry. I left it because I do so much more now in the realms of longevity. I just advise on dentistry now. Just for the record, so people know.
Yeah, I think you mentioned that earlier because someone actually said, did I hear that right? You don't practice it, but that's okay. That's okay. We had Dr. Kevin Stock last year, so it's nice actually. We've now got another dentist that we can bring in, or our ex-dentist, your proper title. So Ribeye Rob, who is a brilliant supporter, thank you, Rob. I'm waiting for a package from Stone and Spear to arrive with its tooth powder that Dr. Chafee recommends. Don't know what that is, but
it's like an alternative to toothpaste, and the key is it's not necessarily what you're brushing your teeth with in terms of the substance, whether it's a hydroxyapatite toothpaste or this, or even some kind of traditional toothpaste. If you were to brush your teeth with nothing, but the physical brushing action removed all the plaque bacteria, you're going to get no issues. So it's actually more about how good you are with the brush rather than what's in the brush, which, it's, as far as the brands are concerned, is a useful thing to not tell you, so they can charge you ridiculous amounts for ridiculous toothpaste. But as long as you focus more on the actual brushing technique rather than what's on it, you'll be absolutely fine.
Yeah. Now you're going to laugh. It's my confession time. Dr. Abs is bringing it. I actually read up about this, the African teeth cleaning with just the finger, really, and the finger.
Yeah.
Now I did try that for a long time, and I was pretty happy with it. And then I just thought, I can't keep doing this. Everyone's going to think I'm a nutter. But it's great to hear that, what you just said.
I mean, everyone in the dental world, the medical world, thinks I'm a nutter as well. I mean, to give you an idea, I think it was around April, I was speaking at the Royal College of Physicians, and on the topic of longevity, and specifically the aspect of nutrition in longevity, which I think is what we're all here for. And when I was talking about the benefits of basically getting rid of exogenous carbohydrates and doing all these things that we all talk about in the carnivore community, people looked at me like I was mad and mental and stupid and something wrong with me. But it's going to take time for people to see the light in this, I think.
Yeah, that's right. And there's nothing wrong with being a bit different. Andy says, I assume brushing can be harsh on the gums. Is it even necessary to brush our teeth, or is it better to just use a softer brush generally?
So you can be harsh on the gums if you put too much force in the wrong place. Now, you're not going to be too harsh on the teeth because that's a mineral. The mineral is much harder than your toothbrush bristles, so you're not going to cause any damage there. If you really push into the gum very hard, then yeah, you can cause a sort of wear and tear on the gum, a kind of recession, if you like. The technical term is abrasion, where you're wearing the gum away using an external object such as a toothbrush, a pen lid, chewing on fingernails, things like that. Is it necessary to brush our teeth? Well, our ancestors obviously didn't, but that doesn't mean that we shouldn't, because it's not nutrition, it's not a drug, it's not something going in our body. It is just a tool to keep ourselves clean. Our ancestors didn't have showers. Obviously, we're going to shower, we don't want to walk around smelling all day. So it falls into that category where it's not natural in the sense that it's what our ancestors would have done, but there is zero harm. It doesn't change our physiology at all, and it can only offer us benefit to keep our teeth clean by minimizing the risk of certain conditions like gum disease and tooth decay. So it's definitely necessary, I would say. In terms of softer brush, again, it's whatever clears the plaque best in your individual circumstance. People with sensitive teeth, they will probably be better off seeing their dentist first to try and identify the cause of the sensitivity. And then the answer to that question will come based on that type of consultation.
That's fabulous. And I've just had a message saying, Richard, is that a picture of you behind you? Just so you know, you look better now than the picture behind you. Well,
thank you. I don't think so, but yes, it is. That was 2 years ago, just after winning the European Championship as a professional men's physique bodybuilder. I've gravitated into Ironman training, so a complete 180. And interestingly, Dr. Abs, you mentioned about powerlifting. I was going to go into powerlifting. When I came away, I decided to gravitate into running and cycling because I tore my pec. I'd never trained for power before. It was all aesthetics, but it was on bench. But just to give you, and you may have a much better idea on this, but when I checked against all federations in age and weight, so at 75k at the time, being 40 years of age, my bench was 165k. My squat was 190 and my deadlift was 230, which put me in a very competitive position. And I'm sure that it put me in like the top 3 in that category in the UK between tested and non-tested. And I don't delve into anabolics. I'm completely natural in regards to competing and healing and repairing my body, which I thought was astonishing. But maybe that's something I'll go back to. But I tore my pec. I was unable to lift. So one of the guys from the local clubs that I work with, one of the athletes, laid down the gauntlet and said, well, if being ketogenic and carnivore, etc., was so good, come and show us what you can do running and cycling. So I've gone into that. So I'm half the size. I'm 20k lighter than I was this time of. So my normal body weight would have been around 90k. And I'd compete sub 70 so this was 2% body fat. But yeah, I'm incredibly smaller now. I prefer the way that I look there, but I know that I'm much healthier and fitter now. And coming back to what you mentioned about abs, I mean, I had veins running through the abs here, but I know that I'm fitter and healthier now, but my abs are a little bit washed out. They're
nothing wrong with that.
Exactly. And this is it. We look at these physiques aesthetically as being healthy, but for me, I know that, if I'm around 9 to 10% body fat. If I gravitate any lower, then that's not a good place for me to be. I can push lower and compete to be lighter, but I always bounce back to this. I always bounce back to 9, 10%. Abs, but washed out. So they're not the type of abs that I ever show anybody, because I don't think that they're worth showing compared to this. But it's funny how, our perception of how we see ourselves changes. But appreciate the comment. Appreciate the comment. That I think I look better there, but thank you.
Well, there's a lot to be said about what that can do for your life. Because if you train appropriately in the right way for your particular age, capability, training status, et cetera, we can't prove it, but I think it's pretty obvious you're going to have longevity benefits. And once you are able to, one of the things I do now is I'm a consultant in biotech research. So we look into basically mitochondrial function and really, really heavily into amino acids. So from that, we understand nutrition, obesity, cancer, et cetera, from the metabolic viewpoint. Now, when we look at what happens when people put on muscle mass, we find immediately that their immunity increases. We find immediately their ability to cope with all the metabolic requirements increases. So when you have more muscle mass, this is preaching to the choir here, but for the viewers at least, one of the studies that we looked at, we looked at this particular supplement, okay, and it's just this certain stoichiometric ratios of amino acids, because we know that when you have amino acids in specific ratios between them, in specific combinations, of which there is an infinite combination, obviously, then you create certain effects in certain parts of certain cells. So when we looked at this particular supplement that we use, this is why you have BCAAs in a particular ratio, by the way. But this supplement, when we gave it to a hospital first of all, they're in hospital, so they're already sick. Second of all, they're elderly. Third of all, they were quite frail. Just by giving them these particular stoichiometric ratios of amino acids, which was designed to prevent sarcopenia, the entire hospital's infection rate slashed by a third. No adjunctive clinical intervention whatsoever, but that was just because we maintained the muscle mass. So people that are on carnivore, I find that they have this excitability to go and train, which they may not have had before. You have that go through cycles in their life where they build the mass in a hypertrophy cycle, which I helped them design, but then also now and again go into a strength style like you did with powerlifting as well. Now, I would say there's a difference between strength and powerlifting, because powerlifting technically isn't power. Power is the speed at which you can move a mass, not the size of the mass. So it's really strength lifting. And then we cycle between those. And that is going to have a huge, huge benefit going forward, especially if you combine it with carnivore as well.
Absolutely. Every so often, by the way, Dr. Abs, your Wi-Fi drops out very momentarily. Yeah.
This is a problem with living next to Chelsea Football Club, where they haven't put a fibre optic in yet.
All right. Okay. Now, there's a few people complaining that, not from you, from me, that we're not covering longevity enough. But I have got questions, and I'm doing them in the order that they've come. So, if we talk about teeth, we will talk about teeth, and then we'll get on to longevity a little bit more. Right. So, yes. Matthew, Dr. Ab,
what a big question here.
Yeah, but it is, isn't it? So what are your thoughts on dentists? Keep saying that fluoride is crucial for healthy teeth and gums. How did our ancestors survive without brushing their teeth and without toothpaste?
Yeah. I mean, it's
Chelsea Football Club. We've just found out that Chelsea Football Club,
they don't have good insight. In fact, Todd Bowley, the owner of Chelsea, is my landlord. That's how close I am to the stadium. So it's a great question. And it's the exact question I asked when I was a dental student. And I basically got the door slammed in my face and told to shut up. Now that I'm not a student and I have the ability to be heard, I would say, first of all, yes, fluoride is something to question. Now, do we absolutely need fluoride? Our ancestors wouldn't have. Now, is there a need in modern times relative to our ancestral times? That's debatable. People can show an increased resilience to acid attack, shall we say, if there is some fluorapatite in the enamel as opposed to hydroxyapatite. Now, does that mean it's entirely justified? Well, what are the negative effects of ingesting things like that into our bodies? I don't think there's many positive effects, frankly, when that is in the water, because fluoridated water is different to fluoridated toothpaste. In toothpaste, I would say it's a little bit easier for the body to deal with because you're going to spit that out. You're not going to swallow it, whereas fluoridated water is something else entirely. Now, fluoridated toothpaste in a traditional Western diet, which obviously not for our community, I think can possibly provide some benefit because it's just under unnatural attack from what we eat all the time. If you're carnivore, however, and there's basically zero external carbohydrates hitting the teeth, do you need that extra level of shielding from acid attack, from mineral dissolution? I would suggest from personal experience and from my patients, probably not. And I think we've heard stories from people in the chat already today saying when they went carnivore, their plaque disappeared, their gum disease disappeared. So if just the diet alone is getting rid of these conditions that we spend so much of our time in the career trying to get rid of, I would probably say fluoride is, for the carnivore community at least, not that essential. I mean, I've been experimenting now probably for the past 6 months with a fluoride-free toothpaste. Let me tell you, it's made no difference. I still have no plaque, I still have no gum disease, I still have no decay. And you may say, well, how do you know? Well, because I'm trained to recognize those things. I give myself a checkup every morning when I brush my teeth. So as long as your brushing technique is good on the carnivore diet, that's really all you have to worry about, in my opinion. I have no evidence. But it is just an opinion.
Cool. Yeah, it's a shame about that dropping out a tiny bit. But anyway, right. So Polish Mike now is saying no sign of periodontitis. Periodontitis, yes. But my dentist, I need to get my teeth fixed. But my dentist said my gums are shifting up, and that may be irreversible. Am I brushing too hard, or perhaps my gums are lacking some minerals?
Another great question. You got some great questions coming here. So
good.
Traditionally, it was thought it was irreversible if your gums recede. I am privy to certain research which is not out to the public. Yeah. Let me start that bit again. I'm privy to certain research where we are not using drugs. We are again using certain combinations of things like amino acids, where we can actually make the gum grow back. So no, nothing oral that you swallow. We are treating the gum directly and improving essentially the functioning of the cell, the functioning of the mitochondria, which allows it to regain what it was doing before, and actually the gum grows back. And if I could share my screen, I would show you some before and after cases. But it's getting to the point where it's not irreversible. But to get to the point where it's taught that it's not irreversible at university, that's going to take many more years. But in the private sector, probably in another year or so, because it's only that far away, we'll probably be able to start to grow the gum back. Now, in terms of what's causing it, typically it will be things like brushing too hard. Because if you're in the carnivore community, it's not exactly going to be carbs feeding the bacteria, the P. gingivalis bacteria, because we're not putting that in there. So I would say double check your brushing technique with your dentist. And that's probably the best you can do right now. And hopefully within a year or so, I've already tried it on people, you should be able to grow the gum back.
Just can I jump in that really quickly? I think that this seems to be a common side effect of beginning a ketogenic or carnivore lifestyle. And I've always had the theory that it was a reduction in inflammation from the gums that has caused this perceived effect of maybe receding gums. So, there we are. Perfect. So I'm happy with that.
So sometimes what happens is when people have gum disease and their gums are inflamed, obviously you need to treat that. Goes without saying. But when you treat it and you reduce inflammation, the patients will complain to the dentist, look, my gums have shrunk because of what you did. No. That was their original size. They looked bigger when you came because the inflammation swells them. And so when you reduce inflammation locally, you reduce the size of that gum. And so it looks like it's receded. It's not. It's just that's the way it was before. That's all it is.
Perfect.
Yeah, and I mean, just relating this to my terrible teeth, if you need a subject who's carnivore for 5 years, seriously, I'd be interested. But I went to have a checkup, and the dentist, who doesn't know how I eat, he said, "Oh, your teeth are amazing. Your cleaning is phenomenal. This is great," and did the pocket size and all that sort of stuff. But actually, aesthetically, they look atrocious. So I look like I've got receding gums. Well, I've got receding gums, and this is fascinating to me. So anyway,
what you've just described there, Stephen, is almost identical to what Rich described earlier. Rich was saying that it doesn't matter whether you can see abs or not to be healthy. That's a modern thing. Our ancestors wouldn't have cared really the way they looked. They just wanted the function to be able to chew their food. So we've ticked the ancestral boxes, if you like, by making sure your teeth are clean and functional. Then we go to the modern era of making everything look nice. That's all it is.
Cool. Okay. Is bicarbonate of soda a good thing to clean your teeth with?
It goes back to, it doesn't really matter what you use. It's the brushing technique. If you was to use nothing, just the bristles alone is fine. I mean, bicarbonate, Just to add, because people have asked the question, a lot of people make the mistake of thinking bicarbonate is alkali. And so they think that they will neutralize the acidity. This is some things I've heard from patients in the past year. They say, well, if I brush with bicarbonate, it'll neutralize the acidity. Yes, it can neutralize the acidity, but not because it's alkali. Bicarbonate is a type of substance that's called amphoteric. Amphotericity refers to the fact that it can behave as an acid or an alkali. Now, there are different definitions of acid and alkali. We have Lewis, Bronsted-Lowry, Arrhenius. For the context of this, it will just say an acid is something that can donate a hydrogen ion, a proton. An alkali is something that can accept. Bicarbonate can do both. So people that are trying to look up bicarbonate and its benefits, if you see somewhere that says it's alkaline, it's not a full source. It can be both. It can donate a hydrogen and go to CO3 2-, and then releasing the hydrogen, or it can go to H2CO3 to neutralize its charge as well. Just a bit of side info, in case, just because we were asked about bicarbonate.
Yeah, we all like side info, especially Richard. He's a real geek for this. Mojo Curios, 1 year strict carnivore, but still having bleeding gums. Why would that be, and what can I do? Worried about the link with heart disease, etc.
Good question. So, first of all, that would need to give a proper individualized answer. You do need someone to actually physically have a look and see what's causing that. But a lot of times, bleeding gums can be something simple, like just putting too much effort when you're brushing, and that's all it is. And there's actually nothing to worry about. Just relax a bit when you're brushing. Other times, it could be because there are bacteria inside the gum, so between the gum and the tooth, what we call the pocket, if you like, the little cuff around the tooth. And part of their life cycle is to basically kind of cause a little bit of destruction until you get more blood flow to the area, hence why things swell. And then upon minimal stimulation, like when your gum dentist just sort of walks that metal stick around your teeth, that shouldn't cause any bleeding. I know people sit there in a dental chair and go, well, yeah, of course it's bleeding because he just poked it with a metal stick. No, if you poke it with that metal stick lightly, it shouldn't bleed. The fact that it has means that there's some kind of bacterial life cycle there. So it's potentially one of the two. Either you're brushing too hard, or there's gum disease there that you need to get checked out in some way, which obviously I can't do here, but it's something to go and double check before it gets worse. If you leave bleeding gums, it gets worse and worse, and then it can go into, eventually, if it's completely untreated, into things like full-blown gum disease. And then if you leave gum disease, that ultimately leads to wobbly teeth and then teeth that fall out, which, in the sense of longevity, one of the things I noticed was older patients with less teeth, they had bigger medical histories. And it took me a while to realize it, but it makes sense entirely. Like, if they can't eat properly, what are they going to be doing in their bodies for any good?
Yeah, it's good. Sorry to be so quick fire, but
that's right.
You've lit up the comments. Yeah, that's amazing. Right. So how many times have you been told carnivore affects a placebo?
It's interesting. So I've not been told that explicitly in those words, but I have had it alluded to me. But you can say that about any diet. You can say that about any drug. You can say that about any effects from anything. There's always a possibility for a placebo. For me, it doesn't really matter whether it's someone says it's placebo or not. It's what you can prove from direct cause and effect versus association. And so whether there is a placebo effect or not, it's not that important to me, because even in a positive direct cause and effect relationship, some people may report a placebo even if they don't notice that positive effect. So it's a bit of a non-question for me personally.
Yeah, and I always counter this with, well, it works because when you have a placebo group in a medication, a pharmaceutical trial, people get better.
Mm.
So all we're actually proving is there's something to believe.
The mind is a powerful organ.
Yeah, and so I never really get that myself, actually, because I think I used to have this in rehab many years ago. I did a rehab clinic, and people come in, say, oh, my back's hurt for 6 years, say, and I would give them some manipulation and tell them what was wrong and what I was doing and how the cavitation worked and all that, and then they get off and I've got videos of this on YouTube because it's great clickbait, and they're like, wow, I can't believe it, or moving their arm. And then they'd say, you just telling me, was it placebo? I went, do you care? You actually care.
Exactly.
You go out and do your shoes up and go up and down your ladders and stuff. It doesn't matter, does it? As long as you're better, really. I mean, it's interesting to know why, but anyway.
Yeah.
All right. This is a great question as well. For a non-smoker, does nicotine gum offer any advantages or risks?
Interesting question. I think we should split that up into the nicotine portion and the gum portion. Nicotine, I think we would all agree, is obviously not something required for human physiology. It is vestigial to human physiology. So in terms of any advantages, if you're a non-smoker because you're coming away from being a smoker, I suppose, it can smoothen that curve for you. That's about it. In terms of the gum, it's an interesting one. I mean, one of the problems, or one of the effects that gum does, chewing gum does in a traditional Western diet, is it reintroduces remineralization of the teeth because it stimulates the salivary glands. You've got a parotid glands here, sublingual, all these things here, and they will release saliva. And when your teeth have had an acid attack and some of that, those minerals have come out of the teeth because of what you've eaten, when the saliva comes back into the environment, the oral environment, and it coats those teeth, the minerals can then go back from the saliva into the teeth. That's why I don't do it now, but I'm sure we've all had a can of Coke at some point in our lives. When you feel your teeth with your tongue, it feels a little bit chalky after the Coke. That's literally the dissolving of your teeth. You're feeling with your tongue the minerals coming out. So if you chew gum after that and you let the remineralization process occur, there's an advantage there because you're minimizing the damage that the Coke did. But in the carnivore community, do we need that? Probably not, because we're not having things like Coca-Cola all the time. But there is another physiological effect, is that it primes the stomach, right? So when you start to chew, you start to release hydrochloric acid in the stomach. And if you're chewing but eating nothing, I don't think anyone's done a study on this specifically, but I would guess it's not the most natural thing in the world for acid to just be released and do nothing. So if you're chewing gum all the time and you're constantly releasing acid into the stomach, you've got to question, what good is that going to do, if any? I would suggest that's not going to do any good for you at all.
Yeah, great answer. We're going to do the last one now about teeth, and then we'll move on to longevity, if you're okay with that.
Of course.
Yeah, great. How to restore receding gums? I know we've touched on this earlier, but I'm just trying to give everyone.
I can add some things. Yeah.
Yeah.
So before I touched on what is coming in the future, but this person said how to restore them after having braces before going carnivore and etc. So now, what can you do now versus what's coming in the future that I'm working on now? So there are certain procedures. So sometimes what you can do is just add a little bit of filling material to the teeth to fill out the gaps in between where the gums were. Might make the teeth look a bit too square. That's an individual thing. You've got to have a consultation to check whether it's for you. Another thing you can do is potentially kind of pull the trousers up on the teeth. You can just take a scalpel, kind of loosen up the gum, pull it down a bit, and then stitch it back in place. You're only really going to get a millimeter or two from that. You need to see a periodontal surgeon or a periodontist specialist for that. Another thing you can do, you can actually cut out a window of gum from the roof of the mouth and drape that over the teeth where the gum line should be, and that will then integrate to become the new gum line. So there's a few options that you can do now. Generally, they're not, the surgical ones aren't an easy thing to do. It's not just go in, 2 minutes later, you're done. So you do need a consultation. You do need to see a specialist gum surgeon or a periodontist. Cost-wise in the UK, you're probably looking at something like 1,000 to 2,000. And if you look after it, that could last decades. But then in the future, obviously, you've got technology to regrow the gum as well. And I wish I could show you the pictures, but it's extraordinary what we can do in the future.
Oh, well, that is incredible. When you say you wish you could show me the pictures, are they confidential then?
No one's explicitly told me on the team that it is confidential, but I could, when I come back later, if maybe I could email you the pictures. Maybe if you can bring them up on the screen, you can get a rough idea of what's possible.
Okay, that's cool. So there's a few people moaning about me not talking about longevity. Yeah, I'm here now. I'm talking about longevity. All right. So
one question, Steve, before we get on to longevity. What are your thoughts, Dr. Abs, on the electric toothbrushes with red and blue lights?
Oh, complete waste of time. So another thing that as part of being a consultant in biotech research, I've actually invented some of the protocols used in LED phototherapy around the world now. And I've consulted for the engineering of those devices. I have taught quantum electrodynamics to the context of LED phototherapy and laser medicine. Now, what you need to look for when you're looking at those devices, and this, I guess, touches on longevity as well, because you can use things like this for the face and healing. You have to look at what is the light. I know it sounds obvious, but what is the light? What is the wavelength of that light? When you're looking at red, ideally, you want it to be around 633 nanometers. When you're looking at blue, ideally, probably around 415 nanometers. If you're looking at near infrared, it's around 830 nanometers. Then you need to ask, what is the range? Because nothing will be exactly 633, really, unless you're talking laser. So the range around that, how much this way and how much that way, is called the peak tolerance. Now, the peak tolerance needs to be as narrow as possible so that you don't waste energy producing wavelengths which are useless. The tightest we've got in the world right now is 2 nanometers. So if you're aiming for 633 in red, the worst you'll get is 631 or 635. Now, the next thing is power. The more power, the more biological change. And I'll explain that very, very simply. These devices are producing radiation. Okay, in terms of the particle, they are producing photons. Some kind of say it's a particle or a wave, whichever makes it easier for you to think. It's called wave-particle duality. But a photon will be released. It will interact with a photoreceptor, which is the technical term. And the photoreceptor for, let's say, red is cytochrome C oxidase within the mitochondrial inner membrane of the oxidative phosphorylation process. And so 1 photon equals 1 unit of change, shall we say. Therefore, it stands to reason more photons equals more units of change. More photons equals more energy, more power. So a higher power device can produce more change. So the big devices that I use, for healing injuries and things in even Premiership football teams, the ones that I get them, they're sort of 20,000 pounds. And the energy level you're talking is 240 joules of energy per square centimeter in 20 minutes, 1200 seconds. Now, some of these masks that you find are sort of 0.0 something, which is just a complete waste of time. So if you think about the device that I get for like professional sports teams and big clinics, it's huge. That's probably the size of 2 or 3 office-sized printers stacked on top of each other. And that's how much machinery is needed to get that size of energy. So if you think of how small a toothbrush head is, how much energy are you getting from that? And how long is it actually staying hovering over one position to create enough biological change of cytochrome C oxidase to have a knock-on effect? You're going to be moving it pretty quickly. So its ability to actually create change, biological change, because it's barely there, and when it is there, there's barely any energy, is very, very gimmicky, really. So I would not waste your time at all. It's probably a very verbose answer. I apologize.
Fantastic.
No, it's great. I think that's fantastic. We do verbose here, don't you worry. Right. So, Dr. Abs, what do you think about GLP-1 in terms of longevity? So many doctors recommend this in lower doses. It is so confusing.
It is confusing. For those of you that don't know, GLP-1, we're venturing into the realms of weight loss drugs. Okay. This is where people look at things like Wegovy, Mounjaro. You may have heard of drugs like Ozempic, things like that. So there's GLP-1s, there's GIPs. So GLP is glucagon-like peptide 1. And these drugs work by essentially slowing the rate of gastric emptying. Now, in terms of longevity, the direct link to longevity, one could make the argument with some reasonable amount of logic that if it controls your appetite and it stops you overeating, then yes, there will be a health benefit and therefore a potential longevity benefit. But the problem with these drugs is it works by essentially turning your digestive system to stone. There is gastroparesis here, and that is essentially a paralysis of your digestive tract. Then you've got the risk of things like pancreatitis. Who in the carnivore community or any longevity community has done intermittent fasting and had things like gastroparesis or pancreatitis risk? Basically no one. And there's a big difference between fasting and starvation. These drugs are essentially giving you starvation. It's not fasting, which is a big, big difference. When you lose muscle mass and lean mass, even from bone, from fat and muscle all together, where do you see that? you see that in starvation, not in health, not in intermittent fasting. And so when you look at these studies that quote 15% weight loss, 22% weight loss, whatever the figure is in different studies for different of the different drugs in this world, half of that is going to be lean mass. When has it ever been healthy to lose lean mass at all? My opinion of these drugs is they are extremely risky. They are not needed in the vast majority of cases. And the risks just are not worth it for the vast majority of people. I say vast majority because I have used them in very, very few cases. And I'll hold my hand up and I will tell you exactly why. I have had a few patients who are so large, who have such a problem, I think you're going to die if I don't do something. And I would rather you have this risk of this drug than seeing you leave this world. And in those cases, I have made the call as a qualified medic that, which I'm capable and allowed to make. I'm okay. This drug is fine for you because even though there are all these risks, I would rather you take it and stop eating and eating yourself to death than the alternative, basically. So I do not recommend them for the majority of cases. I think they are only okay for very, very small numbers of people.
Cool. So, I mean, obviously, these people know you and know that you're in longevity. So is that your main?
I'm very surprised. That is my main thing, yeah. So essentially what happens is, let's say I'm seeing a professional athlete. So I work with teams. I mean, I was at one of the Arsenal players' houses recently, for instance. So it's just a complete life management. So their diet, their nutrition, their sleep, their performance, devices, all these kind of things. And we put them all together. I'm kind of like a personal physician, personal doctor, whatever the phrases will be, and something like that. And then I get other people that come in with, let's say, diabetes, just as one example, and they just want to get rid of that and live a healthy life. So I put a video up, I think it was last week, where I showed it before and after of someone's fasting insulin. It was only 4 weeks apart. But in 4 weeks, we managed to just completely reverse the diabetes, not using any drugs, not using anything fancy, things which I think in the carnivore community people are well aware of. And so we did that. And then now we're working actually on just making them a healthy person, not just reversing the diabetes.
Okay. One more question from me, and then I'm going to hand over to Richard to interrogate you a bit more.
Sure.
Do you recommend any longevity supplements if someone is eating a carnivore, ketogenic, or low-carb diet?
First of all, supplements, my opinion is if your diet is good, you shouldn't really need any supplements. And your supplements should be subject to what is going on in your diet. And I think people have to differentiate the difference between a supplement and a nutraceutical as well. A nutraceutical is something which improves the way your body works in some way. A supplement is something that replaces part of your diet. And that's a big distinction. And I think a lot of companies prey on the lack of distinction between the two. So when it comes to supplements, true supplements, I would say, for me, I do have a protein powder. That's because I work all around the world. I was working as far as like New Zealand not that long ago, and I'm awake when the whole country is asleep. And the only thing I've got there is McDonald's, and I'm not having McDonald's. So I would rather take a protein powder with me and have that than a McDonald's. So for me, that's probably the only sort of traditional supplement that I have. Some people do use a lot of things like omega-3s. The concept is fine. The actual ability for the, docosahexaenoic acid to be bioavailable by the time it gets to you, that's a different subject entirely. I think we have to look at the bioavailability and the rancidity of some of these things. But in terms of nutraceuticals, I think the stem enhancer, which I know Bart goes on about quite a lot, that's probably the only thing that I properly take in terms of nutraceuticals. Occasionally, I will also have things like iodine, just that's for me individually, because again, when I'm traveling, I don't necessarily trust the salt that I've got around me. So I would rather, if I can't trust the salt where I am, I don't know, I can't trust whether I'm getting enough iodine. So I'll just take things like that with me, simply based on travel. But if you're eating a good carnivore diet, frankly, you shouldn't really need to worry about anything like that. I don't know if you guys would agree or have a different opinion.
I have a great opinion on this, and I thought Rich would dive in, as he is a person that deals with supplements, but is not a snake oil salesman, because he says exactly what you say. If you get it from food, that's preferable. He says that exactly, and that's one of the things I've been around this now a long time. 5 years carnivore, 2 years before that in keto and low carb, and I've met two people in the supplement arena who have really risen above everybody else, and they both said the same thing, that you should be able to get this from food.
Yeah.
And then there are places. So I'm going to use the facilities. So Richard's going to take over for a bit, if that's okay.
No worries. You go and use the little boys' room. I'm surprised you've lasted that long.
It's actually a run because it was that.
We'll have to edit that out on the record. But it's Keto Pro, or it's that side is my brand. I got into this after reversing my diabetes and chronic fatigue, depression, anxiety, arthritic pains many years ago after a weight loss of around 107 pounds. And I didn't know what a carbohydrate was at the time, but I quit my job as a purchasing manager. I retrained as a nutritionist, and this is a rabbit hole. And I think within this community, we can know that A gets us to C, but I want to understand the B. And for that reason, I've continued down the rabbit hole. And I'm a big believer in this lifestyle being able to supply us with everything that we need if we live it correctly. Now, the question there is, are most people willing to live it correctly? And what I noticed in the early stages when I began coaching was that you would tell people just to go and eat some steak.
Yeah.
But they couldn't do that because it seemed too much of a big change. We're told that vegetables contain all of the vitamins and minerals that we need. You and I know that that's a complete fallacy. Everything we need is found in animal proteins. But it's so prevalent within the media and mainstream that it's difficult to explain that to people. So I began a different approach, and I looked at how I came into this lifestyle. I didn't wake up being carnivore. I started by restricting bread, and then the vegetable oils. So I gravitated into low carb. Then I became what you'd call dirty keto. Then I gravitated into a standard keto, then clean keto, and I only knew these terminologies after. This was all done intuitively. You learn the carbohydrates break down into sugar, and sugar causes all of these problems. Similar effects on insulin when it comes to vegetable oil. In fact, it's probably more damaging than sugar. But you learn these things as you go. And what I found was the best approach was these incremental changes. If you can wake up and live a carnivore lifestyle, fantastic, then you're on to a winner. But many people, I think, need to make these incremental changes. And for most people, that begins with going down the low carb route. And that's what I do. I offer low carb alternatives in regards to wraps and breads. I don't eat them myself because they contain compounds that I don't want to consume, but I'm no longer in that position. But it all began for me with MCT oils, and I'd love to get your thoughts on MCT. So I produce C8. C8. I produce C8. Mine's the world's highest purity, 99.9%. Yeah, 99.9.
I'm going to have to check that out. I'm going to have to buy some.
Perfect. I'll send you some. Gladly send you some. So I also do it in a powder version. So there's the powder. That's what I'm drinking with the ketones that I have now. But I wanted to. What I found at the time was a lot of these products were available in the States. Very few were available in the UK. And what was available was substandard, coconut oil. Because of the oleosins that they can still cause intestinal permeability, and this is why C8, is far better for you, I believe, than standard coconut oil. And that's what I started to do. And then I started to produce electrolyte formulas that I believe to be, number one on the planet, devoid of all the crap that was in other electrolytes, and with the ratio that I believe is more beneficial. A lot of these others, I believe the ratios have been put in correctly with low bioavailable ingredients. And I've added things like molybdenum, selenium, and astaxanthin. And the astaxanthin, I'd love to get your thoughts on astaxanthin also. Yeah. But it's, when we look at antioxidants, most, if not all of the other antioxidants on the planet are pro-oxidants. Yeah. And they overexpress the NRF2 pathway, whereas astaxanthin doesn't. It doesn't begin its journey as a pro-oxidant. And I believe the benefits there to be unparalleled. And this is a version, and I gladly send you this as well. This is the unflavored version, but this is for the elite. This is the unflavored version. The taste's disgusting because even though there's no nasty, so there's no stevia in this, but as you can see, it's got like an orange or red tint, and that's the astaxanthin. But it tastes incredibly strong. It tastes very fishy. It tastes like the seaside. It isn't just salt, and many can't handle it. But the other version then, which does contain a little bit of stevia, is this one. Now, regardless of your thoughts on stevia, most people would use that, and again, if we live an ancestral-based lifestyle, if we crush the bones and eat the cartilage off, the end of the bones and the connective tissue and eat organ meats, then it's quite possible that we will obtain all of the electrolytes we need from our nutrition, but many of us don't do those things. And it also depends on how hard we're training and working out. Anthony Chaffee doesn't train that much and doesn't use electrolytes. Sean Breaker does, and so on and so forth. But that's, in a nutshell, is what I try to do with the products. I try to bring the best to the market that I believe, while offering the less strict carnivore or someone who's new to the lifestyle and an alternative. And the same with the exogenous ketones. But anyway, that's a long-winded way to get round to the exogenous ketones. There's a lot of opinion on ketones within the community. I believe that they're incredible. I produce them, I use them, but I'd love to get your thoughts, because I think there's a lot of misconception, within the community, and I think they could be both positive and negative depending on the situation.
Agreed.
But yeah,
I think some people seem to have this unhealthy fascination or obsession with ketosis. Your body has been designed to do the best thing it needs to for that situation. If it needs to go into ketosis, it will do it. And when you're a carnivore and you're doing everything properly, I don't think it's something you have to consciously think about or force in any way. However, when you're going into certain goals like weight loss or things like that, I think they can be very beneficial in certain situations for certain people. And C8, I agree. That's probably one of the best ones. It's quickly metabolized by the liver. It's converted into ketones. It gives you an immediate and also an efficient source of energy for both the brain and the body. You get enhanced cognitive function. You can help with weight management, velocity in gut health, anti-inflammatory properties, better physical performance, blood sugar regulation, all these things. I think when someone is in the journey and they're trying to get to where they need to be, it can be useful. But I don't think this is just a personal opinion, I think when you're fully carnivore, and let's say you're eating once a day, roughly speaking, you're probably going to go into a mild ketosis before your next meal because of the time it's taken to get there anyway. And I think your body slowly drifting in and out is what our ancestors would have had. And so for me, that's the most natural, if we're defining natural as what our ancestors had. So for me personally, that's generally what I try and get my patients towards. But on the way there, supplements like that, I'd absolutely have a look at and say that can help you achieve your goals for you. What I am actually experimenting with now, because when I used to train to record level, I used to do all, I don't know any of the things I know now, but I used to do pre-workouts and all this stuff. I'm experimenting now with just taking a little bit of C8 and some electrolytes before a workout, and that's it. And I tried it the other day for the first time, and it was brilliant. Absolutely. I mean, it might have been placebo, of course, but there was no negative side effect of not having the traditional big pre-workout and this drink and that drink all mixed together. So I think absolutely CA should have a place in people's lives when they're getting towards where they need to be. And astaxanthin, you mentioned that as well. Yeah, I think that's, as far as I'm aware, that probably has the highest ORAC value, ORAC, which is a way of kind of measuring the antioxidant stress of a particular ingredient, shall we say. So it stands for oxygen radical absorbance capacity. And I think it comes out roughly kind of 5,000 times higher than vitamin C in terms of that capacity. You basically just use a kind of fluorescent probe to measure the oxidation that's going on. Now, astaxanthin, there was a really famous experiment where they fed some chickens astaxanthin and another group of chickens just the normal food. The normal food was the same, but one had added astaxanthin, and that was the only difference. They got the eggs and cracked them, and I think this maybe on YouTube somewhere. They picked up the yolk of the non-astaxanthin chicken group, and it just, as you would expect, it just kind of burst and the yellow went everywhere. They were able to pick up the yolk by the membrane in the astaxanthin group, and they shook it, and it just wasn't breaking. And that's kind of what it's doing to you on the inside. The issue for me with astaxanthin is just a dose. I think there's a lot of debate on what is the minimum clinically effective dose, what is the point of diminishing returns, and what is the best source. Is it algae? Is it something else? I don't know the answer to those questions, but I don't doubt that there's absolutely positive benefits from taking it.
Yeah,
great stuff. I've got a super chat question for you.
Yeah,
and it's a name I'm sure you've come up against when you talk at longevity. Hello, Dr. Abs. What do you think of Brian Johnson's longevity anti-aging regime of eating tons of contraindicated plants?
So I think we would all agree on the plant aspect. I don't think it takes a genius to work that one out. However, in terms of the other aspects of what he's doing, if we look at the actual cosmetic aspects, it's really not that special. You know, some of the treatments that he's doing is just, it's pretty old school. There's nothing going on. I'll give you an example, right? A lot of people talk about collagen in the supplement form, in inducing it in the skin, whatever. People don't realize there's actually 28 different types of collagen. Some of them are useless in the skin. Some of them are, helpful in preventing metastasis across basement membranes. Some of them, if you increase them everywhere, it probably creates a more carcinogenic environment. And if you look at what Brian's doing in a lot of his treatments, I actually did a video on this on my channel, looking at his sort of cosmetic aspect of his longevity routine. He's not doing anything worthwhile. There's really only one product in the world that is something you can use for your skin to induce multiple types of collagen and elastin and fibronectin maximally. And it's nowhere to be seen in his routine. So I think his diet aspects would all agree is terrible, and his cosmetic aspects, some of it is great, some of it is terrible as well.
Yes. So there's a question that I want to post, actually. I was going to be cheeky and post it as a pseudonym, but I can't. Oh, hang on. There we go. Yeah. This is a good time to ask you about Cellulite.
Yes. We had a question
earlier in the chat. Yeah.
So the first thing to realize is, from a patient perspective, cellulite is a visual problem. If you are a clinician, and I guess some of the viewers will be, and you guys will be in this context as well, a clinician should recognize it not as a visual problem, but as a biochemical pathophysiology. And cellulite, it starts from the storage of fat. Okay, so you have to start all the way back from insulin, from Randall 1963, etc., etc. Once that fat is being stored, what happens is you have to look at the rate of storage. That's the key. It's the speed, because the adipocytes, just like every other cell in the body, need a blood supply. If you then create adipocytes very, very quickly, and the speed of that is quicker than the rate of creating blood flow to the area with angiogenesis, the creation of new blood vessels, then those new cells have been made without any oxygen supply. It's like trying to build new houses without any electricity or plumbing. What the hell is that house going to be capable of, and who can live there? And so these new adipocytes, they enter a state of hypoxia. And so they struggle. They're gasping for air. They're drowning. And so what happens is they become inflamed. And when they become inflamed, they cannot produce the correct extracellular matrix. So for those who don't know, the extracellular matrix is the bit around the cell. The bit inside the cell is the intracellular matrix. And in the skin, between fibroblasts, the bit just in between the cell is the intercellular matrix. So there's three different types. So when these adipocytes get hypoxic, they get inflamed, and then the ECM is dysregulated, dysfunctional. That then makes them even more hypoxic, because they still can't get any blood because of all the dysregulation. And so you get this downward spiral that just goes round and round and round and round. And so cellulite has to break that cycle. You have to stop the inflammation. And the problem is, when you exercise a lot, how do you know that there is no negative effect from the lactic acid that is being built up there? The lactic acid won't last forever, I know, but when it gets produced at some point, it will not be exactly the same pH as before. And what happens is, when you have inflammation in a tissue, from a biochemical standpoint, one of the things that you can define that as is the level of hydrogen ions. When things are very inflamed, you'll get more hydrogen there. So if you don't stop that, you can't change the physiology of that area, because even if you're trying to treat the area by bringing angiogenesis, by bringing new blood vessels to give oxygen and help the cells then normalize, that is reliant on the inflammation not being there. So the inflammation is what you have to stop. So when I treat cellulite, I treat it with the first product that was ever designed to actually treat it, not hide it. And the reason it treats it, again, we're using amino acids to normalize the mitochondrial function, and we are using bicarbonates. And I said earlier, bicarbonates are amphoteric, so it will neutralize it. It's not an alkali, it's not an acid, it can be either. It's a dependent variable based on the environment. So those bicarbonates will take up the excess hydrogen, suddenly inflammation is stopped. And then the amino acids that we use in those specific stoichiometric ratios then go into this, or the extracellular matrix, and then normalize the cell function. Then you start to get a normalization of the area. Now, the reason cellulite has that appearance is because, to put it in layman's terms, fat is stored in like sections. Let's call each section a bag. Now, that bag is made of a particular protein called fibrillin 3. What happens during this pathophysiology is that we have an enzyme called MMP14, matrix metalloproteinase 14, which actually comes down and breaks down that fibrillin 3 bag. And so the integrity of that bag reduces. So the pockets of fat inside start to poke through. And so on the surface, you get this orange peel texture because some are poking through. And I'll put that into an analogy. Imagine you've got a carrier bag of food, of whatever food you want, and the bag is really, really thick. It's like a centimeter thick. When you squeeze that bag, it's just going to be round. Now imagine you've got a bag that's a thin piece of plastic, like a traditional carrier bag at a supermarket. When you squeeze that bag, all the food outlines show through. That's what happens when you lose the integrity of this fat bag. Things start to poke through, and that's why you see that appearance on the surface. So you will never treat cellulite unless you treat the pathophysiology and you reverse that pathophysiology, because it's a downward spiral. So the best you can do without treating it is hiding it. And hiding it is dangerous, because in the process of hiding it, you might make it worse by inducing something like fibrosis, depending on what treatment you go for. So it's important to break that inflammatory cycle, and then you can restore cell function at the same time. And the good news is it's very non-invasive. It's quick. I mean, usually it takes me one session to halve someone's, and I mean literally halve someone's cellulite. If people are interested, there's actually a video on my channel of me doing it, and you can see some before and after in the same video as well. So it's not difficult, but exercise alone is not going to treat it, because the inflammation is still there. The excess hydrogen, the lack of ECM, the hypoxia is still there. And that's a pathophysiology, not just a visual problem.
Yeah, fantastic answers. And I think you're impressing a lot of people who've not seen you before, which is good. You're getting a lot of questions, if that's okay.
Not at all. Not at all.
Okay. Can I get my 83-year-old husband with Alzheimer's to increase muscle mass by eating carnivore, especially beef? I think then I could get him to walk more.
Okay, good question. So first of all, it's good that people understand the importance of increasing muscle mass. When you increase muscle mass, you also increase mitochondrial numbers. And this is going to help you in many, many things. When you increase the mitochondrial numbers, you increase the number of, say, Krebs cycle happenings that go on in the body, because the Krebs cycle feeds into oxidative phosphorylation in the mitochondria. And what a lot of people don't realize is just the presence of, this is crucial, just the presence of the Krebs cycle happening, actually, so without even feeding oxidative phosphorylation, just it being there, and the intermediates within it, just those intermediates physically being present is actually a trigger for the immune system increase. So Krebs cycle intermediates correlate to immune system quality or strength, if you like. And so that's why it's so important. Now, it's good that you recognize that. In terms of increasing the muscle mass, there is really only one thing you can do to increase muscle mass, and that is hypertrophy. It's not something you can go into straight away, depending on the training status that you have. You may have to start with just something simple like walking. There's nothing wrong with that, and work your way up. But in order to increase the muscle mass, you must break the muscle fiber. That is the only way. To increase strength, it's different. You're trying to train the nervous system to generate a larger electrical impulse. In muscle mass, you must be doing failure. You must be going to failure in what you're doing. So I think my view is very similar to Bart Kay's on this. I would say roughly 2 sets, plus or minus half a set, would cover the entire population. And in terms of number of reps, I would say between 7 and 9 roughly speaking. That would cover the entire population. And once you do that to failure, that's the stimulus that will then increase the muscle mass. Now, in terms of just eating correctly, that won't increase muscle mass technically because you're not breaking anything. Eating correctly gives you the opportunity to train and gain well from that training. So eat right, but then use the walking as a pathway to then get him to do more, because walking alone is not going to build muscle mass. There's nothing wrong with walking. That's absolutely fine. We're designed to walk long distances, but then you have to keep scaling up and scaling up and scaling up. If you can get him to do simple exercises to failure, then the muscle mass will start to crumb. And that is really the only way to get the muscle mass increase. It's not necessarily what you eat. You eat the same. It's the training that you do. It's the type of stimulation and the damage that you do that determines how you grow. Is it going to get bigger? Is it going to get stronger? That's all it is.
Fabulous, fabulous. Two very interesting questions coming up.
Yep.
I also like the name, Lotto Retirement Stretches. Right. How do you remove lipedema with Carnivore? Yeah, because lipedema is a hard fatty deposit.
So lipedema is sometimes confused with cellulite. So cellulite, you have different grades. If you have grade 0 cellulite, it's basically no cellulite. Then you get to 1, 2, 3, and 4. If you have grade 4 cellulite, you're not really reversing that, because one of the key characteristics of grade 4 cellulite is sclerosis. So the blood vessels have actually just kind of collapsed. You can't reverse that. It's done. Like you've got no chance of trying to treat that. When you get grade 4 cellulite, visually, it looks like lipedema to people who are not trained in the subject. Lipedema, no one knows the exact cause. There is no definitive treatment. There is debate as to whether surgical treatments are good in either the short term and or long term, but the whole thing is still a rough question mark. Now, you can differentiate lipedema from stage 4 cellulite or grade 4 cellulite, because lipedema generally is going to be, there's going to show a little bit of asymmetry, actually, and some people get it very heavily asymmetrically. One arm might look absolutely fine. One arm like look really, really big, or same for the glutes or the legs or something along those lines. But typically it's lower body. You're looking at areas like, let's say, hips, thighs, buttocks, legs, occasionally upper arms as well. You can get it symmetrical, but I think clinical experience, just my clinical experience, quite a lot of the time, if you look carefully, there is actually some higher level of asymmetry than there is in cellulite. The areas are sometimes a little bit painful to touch, a little bit tender. They may feel heavy, they may ache. And one of the key features is that, potential key features is that it happens because the lymphatic system is unable to then drain the fat. And so things start to build up. So in the early stages, physical therapy in the form of things like massage could help, because that's kind of stimulating the lymphatic drainage. But then if you leave that and there's so much there that you're not physically draining that, unfortunately, it's possibly, unless something comes about in the future, it's possibly a bit too late. There's also potentially a hormonal component. It's progressive. It can easily bruise. Certain things you can't get rid of in terms of risk factor, like genetics. Sometimes it runs in families. But at the same time, if you're eating carnivore, I suspect that is the best prevention that you can do. Just like this, the best prevention for cellulite, because cellulite, again, is storage. Storage is only going to occur depending on how your insulin landscape plays out.
Absolutely amazing. So Penny's got a question, and then I'll shut up and eat my little snack that I'm sneaking in, and get Richard to host her a bit, because I'm sure he's got a million questions. I've got one that's off the top of my head, and this is absolutely from my heart. Okay,
sure.
Where have you been hiding, Dr. Abs? Because you're incredible. You got some great knowledge. Nice guy. Where have you been?
I'm very flattered. I wasn't expecting to even be here. So to get so many questions and things, I'm really, really, really humbled. Thank you. I was in the medical world, just being told to shut up for a long time. Really, that's where I was. And then I started YouTube really not that long ago. I'm going to be honest. It must have been probably only about a year. and I think I'm touching or closing in on 50,000 subs now. So it's grown better than I'd ever hoped. And hopefully there'll be more coming, but that's where I'm going to put most of my content. And then I teach at universities, I teach doctors professionally in courses and things. I consult for companies and hospitals. YouTube is still quite new, so I think that's why I'm basically a nobody still.
Well, I wouldn't say you're a nobody, but I'm sure Rich is thinking, we'd have you on our live on a Sunday night.
I'd be honoured. I'd be honoured.
Okay, that's very kind of it.
I've already DM'd Dr. Labs while we've been talking. Yeah, so you'll
cutting you out of the equation. Right, Penny, any tip for face psoriasis? 7 months on clean carnivore, but horrible face psoriasis on vitamin D3 and K2, selenium, magnesium, riboflavin, and folic acid.
Interesting. So I think there's a few components to that question. Let's break them down. So in terms of psoriasis, for those that don't know, it's a chronic condition. It's autoimmune. It's a skin disease, and it kind of accelerates the growth of skin cells that gives you this kind of thickened, almost kind of like a scaly patch on the skin surface. And those patches we call plaques. They can be red, they can be itchy, they can be inflamed. It can be minor, it can be very severe. It can even look like dandruff in some cases, or it can be covering the entire limb in even worse cases. And I've seen both of those and everything in between. So you've got plaque psoriasis, guttate psoriasis, inverse psoriasis, pustular psoriasis, erythrodermic psoriasis, variety of symptoms. In terms of going on carnivore, nutritionally, that's the best you can do. I think we would all agree. Otherwise, that's what we're all here for. In terms of treating it, it's really not a big deal nowadays. I think carnivore diet will be the first step for anyone anyway, if possible. That will reduce the inflammatory load, and it is an inflammatory condition, and it is autoimmune. However, if you want to treat it directly, if you want to target it, there is probably the most non-invasive and easiest way, which is actually using LED phototherapy. Now, there is only one brand in the world, I believe, that actually has unless someone has come out recently that I don't know, I'll hold my hands up. But as far as I'm aware, there's only one brand in the world that has a medical license to use LED phototherapy specifically to treat psoriasis. Don't know if I'm allowed to say the brand because I don't want to look like I'm sponsored or yeah. So if people want to look it up, if people have this condition, look up something called Dermalux, Dermalux. Just type in Dermalux psoriasis before and after into Google Images. You'll be amazed. I've seen this in person. I've used this. Sometimes even after one session, there is huge, significant changes in the patient. So what that would do is utilize things like near infrared, which is 830 nanometers, which kind of photo displaces nitric oxide out of the oxidative phosphorylation chain in the mitochondrial inner membrane. Once you do that, you allow phosphorylation, the entire oxidative phosphorylation process to occur unhindered. And so you reduce the inflammatory process. And so the cells can function as normal and things start to normalize visually as well. And so that's going to be one of the easiest ways. Now, if you're doing LED phototherapy for it, if it's really severe, I would avoid red in the first place. The reason being, red light in a phototherapy context, when it hits cytochrome C oxidase, it can accelerate the activity of that. And it can therefore accelerate the activity of the cell or increase the activity of the cell. But if the majority of the activity is inflammatory in nature, it could actually increase the inflammation as well. So if you have severe psoriasis or severe acne, you actually avoid red until it becomes moderate or mild, and then you put it back in. So LED phototherapy is going to be incredibly easy. You just lie there, you fall asleep. There's no injections, there's no drugs, there's no side effects. You just got to check your medical history. And that's it. You just lie there and things start to disappear. So that's going to be a targeted treatment that will hit it directly. Now, in terms of the person saying they're on vitamin D3 and K2, well, first of all, D3, I do have D3. I don't take it every day. Again, it's really a travel thing for me. If I'm going to the other side of the world and I'm up when everyone's asleep, I'm never going to get any sunshine. So I will take it in that case. Second of all, you have to look at the dose of D3. There was a study in Norway. I can't remember the reference off the top of my head, but they were sunbathing outside for half an hour, and I think the body produced around 20,000 units of D3. So take that as it's a rough guide. The measurement obviously needs to be called into question, standard error, human error, etc. So the dose needs to be looked at. And in terms of the K2 is, it's a group of molecules called menaquinones, and they are differentiated by the size of those menaquinones. and they're basically used to control the movement of calcium in the blood. And there are cis and trans, which Richard is an expert on this. I'm sure he knows far more about it than I do, but essentially it's to do with the orientation of hydrogens around a double bond between carbon atoms. So if the hydrogens are on the same side, that is what you call a cis. And if they're on opposite sides, that's what you call a trans. So if you're taking vitamin K2, I did do a video on this a couple of weeks ago explaining the nucleation process with calcium phosphate that it does. But you ideally want MK7, menaquinone 7, in a trans form. There's not many in the world that actually state all trans on the back, which is interesting. One of them that I showed in the video was life extension. From comments on the video, I've seen that there are other ones available as well. I've got no obligation to any particular company, but try and get the MK7 as all trans and try and get MK4 as well. So these are used in different places. MK7, I think, is more systemic. MK4 is more for things like the brain and the pancreas as well. So they work together very, very well. And this is something which Weston Price looked at in 1914 as well. In terms of the other things you said there, selenium, magnesium, riboflavin, folic acid, really those things, if you eat a good diet, a good carnivore diet, you're going to get those things from the diet anyway. Those things aren't things that you should take by default. You know, if there's some reason you're deficient, fine, go for it. If you're maybe having trouble sleeping, magnesium in the form of a bisglycinate or something can help with something along those lines. But those are specific issues. They're not a thing to take by default, if that makes sense. I'm giving quite long answers here. I feel bad for taking people's time.
Now, these are great answers. And the thing is, we're known for long answers.
Okay.
We like long answers.
I constantly put out that if you've asked a question, when we do our lives on Sunday, if you ask a question at 7, you're lucky if we've answered it by 20 past. But we try to give full answers. And I mean, I love the fact, I stopped myself talking about MK7 earlier because I felt, sometimes you can get really into the weeds and, 24, even with 24 hours, there's not enough time. The questions are just buzzing through. And I just want to live little bit of light relief just to give you, time to take a breath.
We can carry on. I'm good.
Well, Dr. Robert Kiltz, I wanted to tell you, he thinks it's an amazing chat. So it's really nice there.
That is high praise indeed.
Yeah, that is. I mean, he is an amazing guy. And I got told off because I gave you a list of things about you. But apparently Jill says, I forgot to mention that you're gorgeous. So not really what this is all about. But yes, all right. So, Rich, you've been really good sitting on your hands there. I'm sure you've been wanting to ask a question. Did you want to say anything in particular, or are you quite happy with going with questions from the people?
Yeah, I mean, I'm happy to go with questions from the people. I've thoroughly enjoyed this. Hence the private DM while we were on a little while ago to get you on a podcast. I'd love to get you on a podcast and with Stephen on the live. So.
Oh, you were doing a separate thing. No worries.
Hey, I don't get invited on all your podcasts, and you've got a much bigger following than me. So.
You're booked in for 3:00 in the morning as well. You're still coming back, even though you've done this super sub.
I'd love to. I feel bad that I can't answer everyone's questions. So yeah, I'd love to come back.
Well, let's see if we can get some more up. But you must have one, Richard. Go on.
Yeah, so look, I was, when we look at these NAC supplements, for example, coming back to the longevity, I'm not a lover, and I can explain why, but I'm just curious as to what your thoughts are.
Yeah, so NAC, N-acetylcysteine is what you're referring to. I think again, it's I guess you would class it as a nutraceutical more than a supplement because it's not replacing something from the diet. It's got a lot of benefits. We can use it for health and lots of different things. It's essentially a derivative. It's an amino acid derivative for those that don't know. So it's a derivative of cysteine, which is a precursor to glutathione, which is the antioxidant. Now, it has the antioxidant properties. It can help in things like respiratory health and in protecting the liver, in mental health and immune support, in chronic disease, detox, skin health. List goes on, all these sorts of things. But then what is the appropriate dosage? How do we know? Dosages can range from something like, let's say, 600 to 1800 milligrams per day. That's a big range. Like the top end is literally 3 times the size of the bottom end. That tells me we actually don't know what the minimum clinically effective dose is and what the point of diminishing returns is. So dosage is an issue. Now, you may use higher dosages for specific conditions, like, for example, acetaminophen overdose, but that's very, very specific in certain cases. And yes, it can be considered safe, but what about the gastrointestinal discomfort? What about the nausea? I think rarely there have been allergic reactions as well. Now, if something is causing you gastrointestinal discomfort and potentially nausea, then for me, it's like what you said earlier, Rich. You can go from A to C, but what's the B? And I don't know what the B is that's causing that gastrointestinal comfort. And gastrointestinal discomfort is really important. You know, that's when you look into why GLP-1 drugs, GIP drugs are something which I personally don't recommend for the vast majority of people. You understand that it's a gastrointestinal problem and that affects the whole body. So if NAC is potentially doing that as well, I don't know how it's doing that. So it's not something I would personally recommend to my patients. I don't know if you share a similar view or a different perspective on it at all.
Yeah, I'm inclined to agree. And when we look at other longevity supplements, I try to look at the pathway, and I keep coming back to this activation of the NRF2 pathway, which is a pro-oxidant pathway. If we look at vegetables in particular, this is why I'm not a fan of most vegetables, because they don't begin their journey as antioxidants; they begin as pro-oxidants. And I'm always skeptical of the activation of, or at least the overactivation of the NRF2 pathway. I don't think it's a good thing. I think if we look at pro-oxidant effects, these are the antioxidant effects from some of these, some of these drugs, I believe, doesn't confer a benefit in most people. And again, if you were a sick person and you were to take said supplement, it may help in the short term. But does that mean it's fixed? Does it mean it's addressed the root cause? What's the root cause? And I believe that, coming back to the elevation in glutathione, just being ketogenic and carnivore will do this naturally. The production of the hydroxybutyrate will do that naturally. NAD plus supplements also activate the NRF2 pathway. We come back to it having this, oh my God, what's the word I'm looking for? My mind's gone blank. How far are we in now, Stephen? Nearly 14 hours?
Yes.
So, yeah. My mind's gone blank a sec. But I mean, it's some of these effects, we're told that we begin with a pro-oxidant effect and it leads to an antioxidant effect. But I'm not always convinced that that's the right way to go about things.
And also, I think first of all, I agree with everything you said. You're absolutely spot on. The other thing is the NRF2 pathway is a dependent variable. Human beings are not designed to mess with dependent variables. We're designed to mess with independent variables. For those that don't know, in case we're speaking different language, NRF2 is nuclear factor erythroid 2 related factor 2. It's to do with the cellular defense mechanism against oxidative stress and inflammation, hence why cysteine is used in the production of things like glutathione. Now, when you eat correctly, what is the requirement for a large amount of oxidative stress protection? Not that high. And so that is why our body is not creating excessive levels of glutathione. It's only making the amount that it absolutely needs. And so my viewpoint is pretty much identical to yours. It's when our cell requires regulation in a repair mechanism, whether it's NRF2, whether it's mTOR complex 1, whether it's GCN2K ATF4, it will engage those pathways whenever needed at the right time. It's the principle of that is the same as, let's say, ketosis. Your body will engage ketosis when needed. You don't have to fiddle with these dependent variables. And so that's where I come from, the perspective of dependent and independent variables. I think we just shouldn't really be messing with dependent variables. We should just eat right, live right. Everything will take care of itself.
Yeah, I agree. And I think, one of the arguments is that, there is benefit to the NRF2 pathway, because when you begin a ketogenic journey, this pathway is activated. But I'd bring it back to environmental. So hormesis was the word I was looking for. And that's what people think that, these positives are from plants, is that the hormetic response. But molecular hormesis is very different to environmental hormesis. And I will categorize a keto lifestyle as environmental, even though it's classed as a diet. It's environmental because we are in the state of, technically, to break it down to bare bones, not eating. This will allow us to become ketogenic and produce ketones. So I would put that under environmental over molecular, or diet related. But it's short lived. This is a shock to the system for most people gravitating into a ketogenic lifestyle because they've had a lifetime of not living this way. But it's short lived, 2 to 3 weeks, and that expression is no longer there. At least in my knowledge, to the severity that it is initially. But these are two very different things. Environmental hormesis compared to molecular. I do believe that there is a benefit to environmental hormesis in regards to cold water dipping, red light therapy, maybe.
I agree.
But these are two different things. I don't believe that the pro-oxidant effect leads to any benefit if we are in a healthy state, which. We look at things like turmeric, for example. Turmeric is touted as being one of the top supplements. I'm not a fan of turmeric at all. Turmeric, in my opinion, is not your friend. Again, it activates this NRF2 pathway. It blocks phase 2 detoxification in the liver. We add piperine, which also affects the CYP450 enzyme in phase 1 detoxification, and it blocks UDP, glucuronosyl transferase, in phase 2. And not to allow us to absorb more, but to prevent the body from excreting it as a toxin. And this is what we're up against. We're in a world of all of these supplements that are meant to elicit these magical responses, but whether they confer a benefit in the short term, I don't believe that it's the key to longevity.
Even the wastage of energy. One of the things that NAC will do is, when NRF2 is activated, it induces the expression of antioxidant genes, like those that code for glutathione transferase, NADPH quinone, oxidoreductase 1, hemoxygenase 1. That's an energy-intensive process. Like your energy is a finite resource in our bodies. If your body says, after millions of years of learning, the best thing to do with this ATP here is to use it for this instead of that, I'm sorry, but that your body knows better than you ever will, or a marketing department in some supplement company's brand.
Yeah, I agree. So you're also not a fan of turmeric then?
No, I'm a fan of food.
Yeah,
fantastic.
Now, it's come to that time we're at the top of the hour. I'm a little bit. Jake Thomas is the next guest in the room, but I had him down for an hour's time, and Colt Milton to be on now. So it's all gone a bit.
This is live.
A bit beat on. I don't know Jake, and I've messaged Jake to say I think you should be on in an hour. He's in the waiting room there, Richard. But anyway, Dr. Abs, that was amazing.
Thank you so much.
Amazing. And it'll be great to see you at 3 a.m. UK time.
Yes.
Yeah, I'm very impressed you've agreed that. Are you sure you don't want to?
You're very welcome. I'm good. I'm good.
The same level as Anthony Chafee, who came on for us at 4 a.m. this morning. So kudos to him for that, and kudos for you. I'm looking forward to chatting again. And Robert Kiltz came on super early, so credit to all of you guys. But super looking forward to chatting again at 3. Whether Stephen and I will be as
I might take over if you want.
Yeah, that's fine. Well, perfect. You come on and crack on, and we can take half an hour. But fantastic chatting. I really enjoyed it.
Rest, perhaps, and we'll see you soon.
See you soon.
Take care, man.
Great stuff.